Hi, hello, welcome to Future Nurses YouTube channel. So please subscribe and support our YouTube channel. So let's start today's video. So the first question is Depo-Provera DMPA injection for contraception is used. Options: every month, every 2 months, every 3 months, every 4 months. So DIMPA injection for contraception is used for every 3 months. Option C. So next, hypermetropia is corrected by. So they're asking the treatment. Okay. So options: concave lens, convex lens, toric lens, bifocal eyeglasses. So the correct option is the hypermetropia is corrected by convex lens. Okay, so option B, convex lens. So next, how much blood store and filter in the liver? Options: 50 to 100 ml, 100 to 200 ml, 200 to 400 ml, 400 to 600 ml. So the amount of blood stored and filter in liver is, so the amount is option 3, 200 to 400 ml. The blood will be stored and filtered in the liver. So next, which of the following is not responsible for early abortion? Options: cyanotic heart disease, CHD, uncontrolled diabetic mellitus, hemoglobinopathy, RH incompatibility. So the correct option is option D, RH incompatibility. So next, anaphylactic reaction occurs in dash hypersensitivity reaction. So in which hypersensitivity reaction anaphylactic reaction will occurs? Okay, so options: type 1, type 2, type 3, type 4. So in type 1 hypersensitivity reactions will occur. Okay, so option A. So next, lack of vitamin B may result in poor eyesight, dull skin, tooth decay, poor cellular respiration. So lack of vitamin B may result in poor cellular respiration. Okay, so next question. Burrow ink test is identify which of the following conditions? Options: scabies, pemphigus vulgaris, dermatitis, psoriasis. So Burrow ink test, BIT, identify the scabies. It is used to identify the scabies condition. So next, storage time of RBC is. So options: 40 to 45 days, 35 to 42 days, 38 to 45 days, 30 to 40 days. So the storage time of RBC is 35 to 42 days, option B. So next, joint between the articular processes of two adjacent vertebrae. Options: facet joint, syndesmosis joint, atlantoaxial joint, elbow joint. So the correct option is option A, facet joint. It's also called as the joint between the articular process of two adjacent vertebrae. So next question. The nurse is constructing a nursing care plan for a client post-operative open cholecystectomy. Which nursing diagnosis priority for this client? So the condition is cholecystectomy. So options: risk for ineffective airway clearance, activity intolerance, risk for urinary retention, acute pain. So the correct nursing diagnosis is option A, risk for ineffective airway clearance. So next, which of the following clinical manifestation is seen when when uric acid crystals accumulate in the joints, most commonly in the big toe? Options: podagra, pemphigus, pannus, perfusion. So the correct option is podagra, option A. So next question. Leprosy is also known as options: Crohn's disease, Slim's disease, Hansen disease, Graves disease. So leprosy is also known as Hansen disease, option C. So next, which of the health committee is known as the integration of health services? So options: Srivastav committee, Chada committee, Bohr committee, Jangalwala committee. So integration of health services included in Jangalwala committee, option D. So next, serum fibrinogen sample should be sent in option EDTA vial, plain vial or red top vial, citrate vial or blue top vial, black vial. So serum fibrinogen sample should be sent in blue top vial, means citrate vial, option C. So next, which neurotransmitter deficiency can myasthenia gravis? So options: dopamine, acetylcholine, serotonin, GABA, GABA. So correct option is option B, acetylcholine. So next, the lens of the eye is, so option: biconcave, biconvex, circular, longitudinal. So the lens of the eye is biconvex. Okay, option B. So remember this answer. Okay. So next, the flexion of the knee occurs when the neck is flexed passively, is elicited in a patient. This sign is known as, so options: Brudzinski sign, Karnik sign, sunset sign, Babinski sign. So the correct option is Brudzinski sign. So next, a patient is on digoxin therapy. What kind of food items a nurse will suggest to him? So when the patient is on digoxin therapy, so options: foods rich in K, foods lower in K, salt free diet, high caloric diet. So here K means potassium. Okay. So the correct option is foods rich in potassium. So next, quarantine was originally introduced as a protection against options: plague, tuberculosis, AIDS, malaria. So option A, plague. For this condition, quarantine was originally introduced. So next, most accurate test diagnose cancer of the breast is options: MRI, mammography, breast self examination, BSE, myelography. So the most accurate test to diagnose cancer of breast is mammography, option B. So next, which infection or virus cross the placental barrier? So options: rubella measles, rubella German measles, both A and B, HIV virus. So which infection or virus cross the placental barrier is rubella German measles, option B. So next, Q3 test is done in neonates for mass screening of options: neonatal hypothyroidism, phenylketonuria, hemoglobinopathies, congenital dislocation of hip. So Q3 test is done in neonates for, so the correct option is phenylketonuria. So next, most cost effective family planning method is, so options: copper T, vasectomy, tubectomy, copper T, oral pills. So the correct option is option A, copper T is the most effective family planning method. So next question, minimum level of iodine in iodized salt reaching the consumer level according to iodine programmers. So they are asking the minimal level of iodine. Okay, so options: 15 ppm, 30, 5, 20 ppm. So the minimum level of iodine in iodized salt is 15 ppm, option A. So next, mini pills contains options: only progesterone in small quantity, progesterone and estrogen, estrogen in small quantity, and progesterone in large quantity, only estrogen. So mini pills contains only progesterone in small quantity. So friends, we have come to the end of the video. So please subscribe and support our Future Nurses YouTube channel for your upcoming AIIMS NORCET in 2024 and also other competitive nursing officer exams. Thank you.